Well, about a few weeks ago, YCN talked to Jim Cullen, the president and CEO of the Lake Sunapee Region VNA and Hospice, about their partnering with Connecticut Valley Home Care. Now, last week we talked to President and CEO of New London Hospital, Bruce King, about providing facilities and services to Valley Regional Hospital physicians in the new Newport Health Center. We asked Bruce if there's a pattern now in healthcare of providers working more collaboratively.
I've been in New Hampshire for 29 years, and it's fascinating because the New Hampshire hospitals have had a long-standing history of collaborating versus the years I spent in Massachusetts, which was very different. And so we have always worked well together. There has been the Dartmouth-Hitchcock Alliance, which sort of morphed to the New England Alliance for Health, which is a shared services organization. That's actually 17 entities working together, a combination of hospitals, the VNA up north work together, and we do things in terms of networking and areas of work activity. What I think is also going on, which many people are probably reading and seeing, is a furthering of those relationships to become corporate affiliations. And so I'm very proud that New London Hospital was the first corporate affiliate for Dartmouth-Hitchcock, which occurred in October of 2013. We were followed shortly thereafter by Mount Scottney about a year later in Windsor. Followed by Cheshire Medical Center in Keene, which was back last fall, and then I think people know that in March of this year, Alice Peck Day became the fourth affiliate. At the same time, you're hearing about dialogue with Huggins Hospital and Catholic Medical Center, Monadnock Hospital and Catholic Medical Center. Readers are probably wondering about, there's discussions of renewing dialogue with Dartmouth-Hitchcock and Elliott Hospital. And so yes, it is a trend in terms of, people may have heard that Wentworth Douglas Hospital has now joined the partner system. So in healthcare, all hospitals are aligning with larger healthcare systems. And the reason for that is nobody wants to pay more in insurance premiums. Nobody wants to pay more for healthcare costs. We have many duplications at our facilities, and so the opportunity to consolidate, reduce expense, improve quality of care, and we've actually experienced some of those. So we have already combined our audit functions, our investment functions, our lab functions. We're looking at all different areas to take cost out of the system and not have it affect the patient access or quality of care. And then we've enhanced, in the relationship with Dartmouth, our clinical care, because now we have Dartmouth-Hitchcock specialists coming to the community. And so there is no longer us or them. There's not really two different entities. It's one entity thinking together about how to serve a population. So I think it enhances the relationship with the local community in that instead of having to go someplace else for those services, we're having those services delivered in our local community. And it strengthens both the clinical but also the financial arrangements for the local hospital to stay in business. I mean, hospitals are under a lot of stress. There have been hospitals, part of the reason we were in Newport in the first place was in the late 80s, Newport Hospital went out of business. And that's how New London stepped in to start to provide primary care services way back when. So I think that it actually enhances the relationships. And actually, since we've done the affiliation, and as I think you may know, we had done a lot of community forums, people are generally very glad that we have this relationship with Dartmouth, that they're seeing Dartmouth specialists, that we're getting savings out of the system, and we're improving the quality of care while we're lowering our cost.
It looks like the healthcare business is responding to the need to keep costs down but continue to provide top quality care. Now, in this day and age, it is great that providers are really working together to become more efficient, especially here in our area.